There's a new dominant COVID-19 strain in the United States. It's a variant of Omicron called BA.5. 9Health expert Dr. Payal Kohli is here with the details. Thanks for coming in.
Good morning, Corey.
So what is this new variant?
So it's a subvariant of the Omicron strain. So Omicron's the parent variant, and this is BA.5. And essentially, if you look at the growth of this variant, it has surpassed any other variant or subvariant that we have had so far, which means it's spreading incredibly quickly. And the reason for that is because it has mutations in the spike protein that actually allow it to evade our immune system. So, you know, the antibodies that we have from prior infection or from vaccination, it can really trick those and continue to divide. Now, this is all also on the background of the fact that the masks have come off in most places. So when you layer those two things together, we're seeing essentially an explosion of cases with this new variant.
So this one's more contagious, but is it less severe?
The most contagious variant yet, but thankfully it appears, at least based on the preliminary data, that it doesn't appear to make you as sick as the Delta variant or some of the older variants. So it's probably similar to the Omicron variant, which is BA.1, in terms of how sick it makes you. Now, of course, if you're vaccinated, you're less likely to get sick with this variant than if you're not.
Now, are people getting reinfected with the variant soon after having Omicron?
Yes, and that's what has us really worried about this particular variant, because usually you think, okay, well, you've got Omicron, you have a honeymoon period, so to speak. But because this variant evades the immune system and tricks it, we're seeing people who got Omicron in January now getting reinfected with this BA.5 variant. And in fact, lab data even tells us that if you've had Omicron and you've been vaccinated, you can still get infected with this variant because it's outsmarting our immune system.
What makes this current COVID situation so challenging for experts?
You know, we're in a whole different place than we were a year ago. One, because we're intermingling more, but I think more importantly, we're going blind because we used to have a really good track of case counts and positivity, and that would help sort of assess how bad things are. But now we're thinking that we're underestimating cases by 7 to 10-fold. So in other words, the daily case count is about 120,000 cases, but some experts say it could be up to 1 million cases a day in the U.S. We're just not counting them because they're coming and positive tests at home.
Right, the at-home tests, people aren't reporting them. So why should people care if this seems to be like a cold?
Yeah, that's an important question. So first of all, we're having 300 people still dying every day. So that's a plane full of people that are still dying every day from COVID. So certainly people can get very ill from this. But even for those of us where it ends up being pretty mild, we're actually seeing data now that tells us that if you get COVID over and over again, your risk of permanent organ damage goes up, and your risk of long COVID goes up, and your risk of getting sicker with the subsequent infection also goes up.
And that's kind of interesting because, you know, we're so used to getting colds every year, right? But that doesn't change it. But for this, if you're getting COVID more often, that could be a problem.
And it's different because we're getting these new variants that are trickier and are evolving in such a way that they're actually, in a way, even though they don't make us sicker, they're wreaking more havoc on our organs. So it is a little different from those colds.
Do you think that vaccines will kind of shift and change to include BA.5 or new variants that are coming out?
They have to. In fact, the FDA mandated that in June of the vaccine manufacturers, anticipating what's going on. But I'll be honest with you, in my personal opinion, it's coming too slow. Those updated vaccines should be here now, because come the fall, we're thinking there might even be another variant. In fact, there's one in India that's also here in the US now, BA.2.75, that seems like it's even more aggressive than BA.5.
All very interesting. Dr. Kohli, thank you for coming in. Happy Friday.
Thank you. Happy Friday.